Welcome to Health and Harmony Beyond the Teeth, where we dive into all subjects that will help you become healthier and happier. As a dentist, I believe dentistry is more than just teeth, so I created this show to focus on overall health. We will hear from leading experts about eating better, exercising better, breathing better, and sleeping better. We want to help you create harmony in your life so you can live your life to the fullest. We want you to thrive. Hello, welcome to Health and Harmony Beyond the Teeth. I'm Dr. Hal Stewart, your host, and today is February 27th, 2024. We're off to a roaring start of the new year and getting into it. Hopefully, a lot of you are sticking with your New Year's resolutions, and if you are, great. If not, if you're starting to stray a little bit, maybe today's topic will help you get back on track. It's a pleasure to have once again with us Dr. Matt Barker, Director of the Integrative Pain and Wellness Center in Southlake, Texas. Dr. Barker, welcome. Glad to have you with us today.
Thanks for having me on. It's a pleasure to be back.
Today, we're going to talk about emotional transformation healing. Really a fascinating topic because when we think about healing our bodies, we think about the physical part of it, but there's also an emotional and a spiritual and even a psychological part that goes with it too. So, Dr. Barker, I know that you do a lot of this, and a lot of this stems from how you practice from your own quest to seek health for your own issues and health issues that you had. How can you explain? People talk about our body storing trauma. Well, first of all, let's back up. Tell me how you got into this and how this has kind of enveloped in the way that you practice.
So in osteopathic medical school, we learned that the mind, body, spirit connection. So if you think of your health like a triangle, and at one tip of the triangle you have your musculoskeletal health, at one tip you have your organ health, and the third tip you have your mental, emotional, spiritual health. And dysfunction in any one of those categories can cause issues in the other two. And I always believed that in theory, and I thought I was practicing it within my practice. And so in my patients who were presenting with depression, anxiety as a problem that they struggled with, I was looking for the musculoskeletal or the organ related, hormone imbalances, gut health issues that may be contributing to their depression, anxiety. But I wasn't directly doing anything to treat the mental, emotional, spiritual part in my practice. That stuff I was kind of referring out. And then in my patients who didn't say, hey, Dr. Barker, I'm depressed, anxious, I was totally ignoring the mental, emotional, spiritual piece of their chronic pain or of their gut health problems. And what I realized is we all have a lot of need for mental, emotional, spiritual healing. And I thought that I was in the category of, no, I'm not depressed, anxious, so I don't have any need to really focus or go to a therapist or go and do a lot of like spiritual, mental, emotional work. And when I realized that I had a huge need for it and started to learn tools that helped me in my own journey, I started incorporating those into my practice. And I realized that almost every single physical problem has a mental, emotional component. And if you don't address that piece of it, then your efforts in treating the musculoskeletal or in treating the organ dysfunction are not going to be as effective.
So, you talk about people storing up trauma in their body. Obviously, the physical part of the trauma, that's obvious to everybody because it hurts and it's debilitating. Explain the phenomenon about storing the trauma from more of an emotional, spiritual level.
Yeah, so anytime you perceive that a trauma, and that can be like a physical trauma or like an emotional trauma, like somebody breaking your heart or any kind of injustice. So if you perceive an injustice has occurred or a trauma, you automatically generate some negative emotions. That's built into your system, built into your DNA. And so we're designed as part of our protective mechanism. So if you happen to cross the bear, that fear that you generate that's so quick is supposed to turn on your fight or flight response so you can hopefully run or fight and survive. that bear encounter. And so every time that you perceive that something is awry, you're going to automatically generate negative emotions. And negative emotions are inherently uncomfortable. I mean, most people don't like being depressed, anxious, frustrated, panic. They're physically uncomfortable. And so we often resist feeling them. And so we suppress, repress, numb, ignore, distract. And it's due to the resistance to feeling those emotions that actually causes them to then become stuck within us. So an emotion is actually energy in motion. That's like what an emotion is. So that energy that's been created of fear or panic has an agenda of what it's trying to accomplish in your body. It's trying to change blood flow patterns, change hormones, neuropeptides, and different chemicals in the body. And so when you resist feeling that, you block that energy from fulfilling its course, and that energy then becomes stagnant within the body and basically can stay stuck forever. So there is no expiration date. Once an emotion is stuck within the body, it can stay there until the day you die. And interesting, I find this part fascinating. When you have kids, you actually pass some of your unprocessed emotions onto them. So they not only can last the rest of your life, but they can last generations of lifetimes.
So just like passing genetic defects or maybe positive genes down, we can pass those negative emotions as well. How does somebody? So if somebody has these emotions in them, it's kind of like, I think, kind of like a fish. Does a fish really, is he or it really aware of the water, that it's in? Maybe not until they're out of it. But do you encounter people that have these negative emotions, that maybe they're depressed, that don't even realize it?
For sure. Well, I was very clueless to the amount of emotions that I was holding on to. I used to have the mentality or the belief it's not good to be depressed, anxious, frustrated, jealous. So I got really good at pretending like I wasn't those emotions. It didn't mean I wasn't generating those emotions. I just got good at pretending like they weren't affecting me. And I thought, the old thought like, oh, let them roll off your back. I thought that they were just rolling off the back, but really I was holding on to a lot of that stuff.
So that's
And
where you're storing them by kind of ignoring them and saying, "Oh, that's normal. It'll go away," or whatever.
yeah, so that's one of the mechanisms that they become stuck is through kind of distracting your mind away. And so I remember I used to use a lot of these distraction techniques about listening to music or watching stuff to keep my mind distracted, because basically your mind is like a stage, and whatever emotion is occupying the stage of your mind, that's going to be running the show. It's going to create thoughts, it's going to make you feel or act a certain way. And so one way to keep like negative emotions off the stage of your mind is to keep something else on there. So thinking about, food, for example, and then, you're hungry all the time, wanting to eat, or, watching stuff or listening to things or staying busy, someone who's like a workaholic, what is it that they're trying to stop from coming up if they're just sitting quiet?
Is there a is there like when we have trauma, physical trauma, and we get inflammation. We think of inflammation as bad, and of course, chronic inflammation at a cellular level obviously is. But inflammation, is good in that is the healing process for a wound or whatever. Is there a physical advantage to experiencing negative emotions as long as we deal with them correctly? I mean, because we're all humans, and that's what sets us aside from animals, is that we do have that emotion, cognitive emotion you know that certain other species don't have. Is there some good that comes out of dealing with negative emotions in the right way?
Yeah, so negative emotions can protect us. So you brought up like how we're different from animals. Let's use the animals as an example. So you have the gazelle, and the gazelle's just minding its own business, eating grass. the lion comes up, and as soon as the gazelle is aware of the lion, it's going to generate fear. Okay, so we would think of fear as a negative emotion, but in this circumstance, it's protective.
Okay.
Okay, so that fear helps to turn on the gazelle's fight or flight, so the gazelle can hopefully run off, survive. But as soon as that gazelle is out of danger, it goes back to being a gazelle, eating grass. It's no longer scared, worried, and having fear about the lion. And sometimes you'll even see animals shake off after they are in a pursuit or after they get into a fight. They're shaking off that extra energy. So
Mhm.
this phenomenon of emotions getting stored within us is quite unique to humans because of what you mentioned, that we have, the higher brain centers where we can think about the past and worry about the future.
Yeah.
And so that's where the problem becomes. Emotions are not bad. There's good and bad, there's positive and negative emotions, but they're not inherently bad. It's just they're supposed to be short term. They're not supposed to be prolonged. Countless studies showing that chronic stress leads to health disease, heart disease problems.
So, what are some things that people can do to release the negative emotions? And I know that's in a just a few minute interview here that we're having, you can't get into it, but just off the top of your head, what are some things that people can do?
So it's actually not like an hour long, day long, month long process. I mean, to release emotions, it only takes seconds. It's actually a lot easier than we perceive it to be. We're not taught to process our emotions. In fact, we are conditioned to suppress, repress, numb, ignore, distract. Think about how many times when you were a kid, or even now, hearing things like, "Oh, stop crying, stop being a baby, stop being a girl, suck it up." And so we're actually conditioned to not feel our emotions, which is what causes them to become stuck. So to process an emotion, it just takes two things: awareness and intention. Okay, so awareness is acknowledging, identifying that you're feeling something. You may know exactly what emotion you're feeling. You may know, oh, I'm feeling anxiety or panic or fear or jealousy. Or you may just feel that you're feeling something negative, a negative emotion, and not even know what to name it. But the acknowledgement part is you don't have to name it. So whether you would call that emotion lack of control and I call that emotion helplessness, that's not that important. So just acknowledging that there is some kind of emotional energy within you, that's the awareness part. You bring your awareness, I'm feeling blank. And the once you have the awareness, the key is to get out of your head. See, most people, if they get to the awareness piece, then they get stuck in their head and they want to try to either, you know, justify why they're feeling the emotion. So they think about all the reasons they have to feel anxious or to feel jealous, or they judge themselves. Oh, I can't believe I'm feeling this emotion again. Like I'm so bad. I keep falling into this routine. Or they try to distract themselves away from it or try to go into problem solving mode. So you want to get out of your head because that won't process the emotion. And you bring your awareness to your body. So the second step is the intention. So if you have the intention to release the emotion, you basically identify where you feel the emotion in the body and what it feels like. A negative emotion can cause a wide variety of physical sensations from head to toe. I'll name a bunch. So numbness, tingling, tightness, pain, pressure, hollow or empty feeling, something in the pit of your stomach, nausea, loss of appetite, something in the chest like chest tightness, hard to take a breath, sensation to cry, a lump in the throat, a temperature change, a heart rate change. So you basically identify where and what the emotion feels like, and you become the observer of that emotion happening in the body. So you basically are just sitting and allowing that emotion to be. This is the kind of the tricky part, is learning to surrender to those uncomfortable feelings without trying to stop or resist them.
So, probably most people have a combination of those things you just talked
Oh
about,
yeah.
and they feel
Yeah.
overwhelmed. So, what are they? what do they concentrate on? Just their overall feeling of pain and depression, or what? You know, like my back's killing me, my foot's killing me, my shoulder's killing me. I've got a headache. I can't sleep. You know, there some people would be, I think, would feel really overwhelmed. Where do I start?
Yeah, so you're only going to have so many emotions at the surface where they're actively trying to affect a change in the body. And so those are the ones that you're going to actively be feeling. You don't have to release every single emotion to reach a state of peace, because most of your emotions are currently suppressed. So they're not actively being experienced by you, but for every negative emotion, imagine you have like an invisible button. And so if you are reminded of the event that caused that emotion, it pushes that button and you re-experience that emotion. So the easiest time to do this practice is when you're feeling an emotion already. So if something pushes one of your buttons, say you're listening to a song on the radio and it's talking about a bad breakup, and you're all of a sudden remembering and thinking about your bad breakup, and you're feeling heartbroken, you're feeling sad or lonely, that's the perfect time to bring the awareness. Okay, I'm feeling sad, I'm feeling lonely. And then bring your awareness to the body, and how does this emotion currently feel? And just sit with those uncomfortable feelings, and you'll feel the energy of that emotion kind of rise up. And as you just sit with it and let it be, it will start to diminish. Now, the symptoms that you're feeling connected to the emotions, they may fully go away, or they may just get a little better. And if they just get a little better but don't fully resolve, that just means there's other emotions contributing to what you're currently feeling. So then you would go back to the awareness piece. Okay, what else am I feeling? And you identify the other emotion, and then you go back into allowing yourself to feel it.
Do you think every physical ailment, injury, chronic injury, chronic health issue it has a tie to an emotional? Is there an emotional part for
I
that
would say
injury?
just about. I wouldn't say it's 100%, but it's a very high percentage that there's a mental, emotional, spiritual component. And there's actually a difference between each of those categories when it comes to healing: the emotional component, the the mental component, and the spiritual component. So that would kind of, we can dive into that one on a future talk, because that one gets kind of lengthy discussing the difference between those three components.
You know, it's interesting because I was when you and I had talked briefly about this several months ago, and I was thinking back about the motorcycle accident that I was in. My wife and I were in, and I was thinking, well, okay, we're perfectly fine. The next minute, I've got a torn rotator cuff in my shoulder that has nothing to do with an emotional. But for months after that, I would have dreams of that motorcycle accident, and then what if I hadn't, what if I'd hit the guy harder? And so even though there wasn't an emotion attached to that before it happened, as soon as it happened, I realized that pain in my shoulder every time I felt it, it reminded me of that accident, which was not fun at all. And I kept reliving it in my head. And so that kind of started making sense to me that I needed to deal with that. One way that I dealt with it was promising that I would never ride a motorcycle again, and then I won't have to worry about that again. But I can it that really set home to me that there is an emotional component. I've got a chronic back problem right now that I'm dealing with. I actually need to come and see you about that. But it I think about how, well, I used to be able to run. Now I can't run anymore because it hurts. And so that's the emotional side coming out about it. I used to be able to do this. Now I can't do it. And, you know, that's not exactly a really happy thing to think about not being able to do something, but it's tied to a physical ailment.
Yeah, so that the emotion that's correlated to what you're talking about with that loss of function would be grief. You're grieving the loss of your ability to exercise the way you want.
Mhm.
And so from some past trauma that you've had, where you had the injury and it caused you to lose some sort of function for a while, and you didn't like that. So there's this belief within you that if I get injured, I'm going to have a loss of function. So you now have a new trauma, and you have that belief within you based on your past experience saying, I'm having a trauma right now. The emotion grief is automatically generated because you've had past trauma that caused you to grieve the loss of something.
Yeah. Yeah, and it's interesting because every time I see a group of guys and or, men or women or both riding by me on a motorcycle, I get really angry at that driver who was on his cell phone and pulled right out in front of me. And it's like he took that away from me. I loved riding motorcycles and he took it away from me. So I've gotten much better at that. Now I just think back with fond memories of riding the motorcycle. So in some ways, that was a negative emotion that was tied to that because of what happened. Um, so I can actually see I mean, this is an obvious question, probably, but maybe not. So, and then we'll wrap things up. But what is the benefit of releasing negative emotions?
So when you have negative emotions stuck in the body, they cause both physical and mental health problems. So physically, negative emotions do have they vibrate at a lower frequency, which is not sustainable long term. So if you hold on to the emotions that you generated from the motorcycle accident in the shoulder, then those emotions can actually impair your body's innate ability to heal from that physical trauma. So physically, they cause a lot of problems. They can cause pain, swelling, dysfunction in whatever organ they're stuck in. They can basically cause dysfunction within a whole system. So they can cause cardiovascular problems or contribute to the development of cancer or autoimmune conditions. So physically, they cause a lot of problems. And then mentally, just like you brought up several occasions where that the emotions from that motorcycle accident keep getting triggered every time you're seeing a motorcycle or every time you're feeling your shoulder, you're re-experiencing those emotions over and over and over, and that's unpleasant. So emotions are meant to be short term and only needing to be experienced one time for each time that they are generated. So this becomes really problematic, where it becomes clinically pathologic. We call it post-traumatic stress disorder. So somebody went through a trauma that was so significant that every time it gets triggered, the emotions become overwhelming. And so it's such a large emotional response that they can't function without, getting those emotions released and getting therapy. Or another phenomenon would be like a phobia. So somebody is, deathly scared of getting on the elevator or getting on a plane or, driving on the freeway. So that activity is pushing a lot of buttons. And so now they're experiencing the emotions of a bunch of different events. And so that's why that phobia is so overwhelming for them. So by releasing these emotions, you're now emotionally unattached to those past experiences. And so the sign that you have released the emotions from an event is you can think about that event and it doesn't bring up the emotions anymore. So you can remember how you used to feel, but you don't feel that way anymore, almost like it happened to someone else. It's not going to affect you the same. They're not going to have the same sting. And then physically, by releasing those emotions, you help your body to be optimized so that that energy is no longer stagnant and blocking your normal energetic flow.
Yeah. This might be, tell me if this is a good thing. I think I know what you're going to say, but what I started doing with my motorcycle accident, instead of when I would see a group of people driving by, instead of thinking, he took that from me, I can't do that anymore, I started thinking, I could be dead right now, but by the grace of God, I'm alive and it could have been a lot worse. And I take joy in knowing that I'm still alive, I've healed, and replacing that emotion with that guy that he took something from me that I can never get back again. Is that kind of the right steps to take when you're dealing with something like that?
Yeah, no, I think that that's a good strategy for it's like reframing the way you're looking at an event. So that's definitely part of the healthy process, is to reflect back on these life experiences and look at it with a new lens. But you're going to have an easier time doing that after you've released the emotions from the event, because now you can look at it with fresh lens, and you're not looking at it from your emotional place of grief. But yeah, that's a useful strategy as far as reframing and looking at it a different way, and seeing the blessings in that traumatic experience.
And so you work with your patients and you kind of teach them how to identify, how to be aware of it, and then how to take action to release the negative
Yeah,
emotions.
yeah, so I help all my patients that are open. Most are open to it because they see the value in it,
Mhm.
and I can help patients in the office to find and release negative, unprocessed emotions. In fact, you can actually have positive emotions get stuck, but we can save that for a different podcast because it's a new topic.
Yeah,
But I also encourage all my patients to learn how to process their emotions on their own, because if you're only processing emotions when you go see somebody, once a month or every 6 weeks, like, we generate emotions every day,
right.
usually more than just once. So
Mhm.
if you're only doing it once a month or every 6 weeks, it's not enough. Like, you want to learn to have this be part of your daily practice. And
Yeah,
just the more you practice awareness and intention and going into that surrender, the easier it becomes.
yeah. No, I can see that. I mean, most of us deal with, you know, we may have a negative emotion at 9 o'clock and then everything's great. Then another one at 2 o'clock, and then another one when we get home. So we need to be dealing with all the time. Well, we're gonna have you back on in a few weeks, and you can explain your model of emotional transformation healing and how releasing negative emotions fits into the model. But I think we got a really good introduction to it today. It's fascinating. Maybe next time when we talk, you can maybe have some literature. I know there's one book that I would recommend to our listeners, and I can't think of the name of it. I read it about 6 months ago. I've got it. I'll bring that up next time too. But it talks about that emotions and thoughts are real. They're actually have a physical. They can actually we can actually see thoughts in the brain now physically with the technology that we have. So um, they kind of generate themselves. They look like trees when you look at it on the in the brain on the brain. In the part of the brain where these thoughts go. So it's just really fascinating. So I think you're onto something here. I know you are. And I know your patients are really benefiting from it. So, and this is something that you don't walk in with a prescription pad and say cough. Let me listen to your heart, and then write a prescription. This is something that you spend time with your patients, right? I mean, you're connecting them on a deeper level than just physical.
It's been so rewarding to add this. I've always enjoyed helping my patients and helping them to feel better, and being in that kind of healing role. But as I've added this mental, emotional, spiritual component, it's just taken it to a whole new level. And I didn't used to be an empath. So I didn't used to feel my own emotions, let alone someone else's. And as soon as I learned how to process my own emotions and started working with patients to help them, I started having experiences where I could actually feel the emotions that they had going on. And so sometimes I will feel their emotions, and I can help them to process the emotions, because all it takes is awareness and intention. And
Yeah,
so as soon as I'm feeling an emotion, whether it's generated from you or from me, I know how to surrender an emotion. So I go into that surrender mode, and it automatically helps to release it, not just for me, but for the person that it originated with.
interesting. That's fascinating. And next time we'll talk more about that, about the what you actually do with your patients, so they can so our listeners can get a better understanding of it. But I want to thank you for being on this morning, and I know our listeners will get a lot of out of this. So Matt, Dr. Barker, thank you so much, and we will talk to you next time.
Thanks for having me. Have a great day.
Yeah, this has been Health and Harmony Beyond the Teeth. I'm your host, Dr. Hal Stewart. We will see you guys next time. Have a great day.